governments. And one of the things that David Blunkett touched on, which rang a real kind of resonant bell with me, is how often officers in public sector agencies don't get the voluntary and community sector. They don't get volunteering and the different way of working in that. So this kind of learning from the third sector by bringing us in together and working together was a really important part of the process. I think David Blunkett talked about the welfare state remembering the volunteering that was its history, and so actually bringing them back into a less of a separation between third sector and public sector has been one of the kind of key ambitions of the strategy locally. The last thing on that slide in terms of single outcome agreements with Scottish Government, I don't know whether this has something that has resonance, but certainly in Scotland currently, politically, with the SNP government, one of their big pushes has been the localism agenda. And what they have required of each local authority area is that they have a single outcome agreement that says what that local authority area will do in order to meet government targets. Now, traditionally, in the first iteration of these, and this is the second year of the process, in the first year, that was just a public sector document, and it was almost exclusively just a council document and said what the local authority would do to meet on government objectives. What it is now, and what it is intended to be, is a community planning document that says what we will all do to share and work together. So there's been quite a lot of work in the strategy in making sure that volunteering interests and voluntary sector interests are actually embedded throughout the public sector bits of service delivery and the third sector service delivery together in that single outcome agreement. That's been quite hard work, I have to say. Benefit-wise, the power of well-being is one of the things that, again, councils are kind of charged with in Scotland. And it's been one of the reasons, again, that the council has been very supportive of working with volunteering, because it recognises that actually itself in its own service delivery can't advance the power of well-being, because actually the power of well-being is advanced by us, by citizens, by individuals, by community groups, and by the voluntary sector. So it's been important to kind of push that through. And getting public sector staff, I mean, looking at the kind of corporate social responsibility bit here, one of the big pushes of the volunteer strategy has been to try and get the public sector staff to also volunteer in their own time. And that's actually sometimes quite counter-cultural. The private sector are better at doing that quite often than the public sector, who think, well, we already work for the public, so why would we also volunteer as well? So that there's been a bit of a push on that. I have to say, some of these things that are at a senior strategic level signed up to by the council and the partners are still aspirational at a kind of getting it actually bedded down, because the senior politicians and the leaders of the council and the sort of senior policy officers all sign up to things, but actually in such a huge structural bureaucratic system, it's often really quite hard to get these cultural things bedded down, but it's beginning to work. So moving a bit to have a look then at what has it actually done? What's the kind of impact, if you like, of having had a volunteer strategy for the last 2 years. 2007 was the kind of formal launch of volunteer strategy in the city, and it had 3 key objectives, if you like. One was to engage people, more people, better in volunteering. The second was to improve the volunteering experience. And the third was about resourcing and supporting volunteering. Now, the first key objective it's about engaging more people in volunteering, has a very, very heavy focus on inclusion and participation, and actually kind of closing the gap in participation and volunteering rates, because certainly in Edinburgh, twice as many people from affluent areas volunteer as from less affluent areas. So there's a big bit of work to do in increasing kind of participation rates in less affluent areas. There's a lot of work to be done in youth volunteering. There's a lot of work to be done in helping people who are furthest, who are least engaged, become engaged, and some of that's in employability and things like that. But there has begun to be, having had this in place for a couple of years, and in the volunteering bit, the key partners who've been really pushing hardest on it are the council, obviously ourselves as the volunteer centre and the voluntary sector partners that we work with. The council has been an absolute lead on it. Health has been astonishingly proactive, actually. NHS has been really, to all of our surprise, actually, I think in the third sector, really come on board very strongly with the kind of the volunteering agenda, and has been kind of pushing that forward. But also people like Careers Scotland and the kind of the career development kind of enterprise bits have been pushing hard on it. So what's sort of been the impact of where we are now? Overall, very healthy. An increase in volunteer numbers. Now, volunteer statistics are lies down lies and statistics, as we know, in everything. So our relative increase may be relative or not to anything that you will have done in your volunteer surveys, but on the same set of data and the same questions, we've seen a rise in volunteering in the city. And a rise in volunteering on boards and committees of voluntary organisations, because that's one of the things that the strategy has tried to push quite hard, is the sustainability and viability of small community groups that have often really struggled in that. But there's still a big income gap in affluent and less affluent areas. Some of the very tangible things that have happened and have been invested in, I suppose, by the public partners, are developing more volunteering hubs around the city, particularly in regeneration areas. It's been an aspiration of the Volunteer Centre for some time to make sure that there are mini volunteer centres, if you like, in the areas where people are least likely to volunteer. And there's been a degree of investment in that. And talking about the NHS, the hospital hub that it was talked about, actually NHS, from being part of the strategy group, then said, well, actually we should really have a volunteer hub in the psychiatric hospital, and commissioned us to set one up and go and do one, which is about, in Edinburgh there's a very big psychiatric hospital that over the next 5 years is being decommissioned and moving into a kind of community base. So what they were very keen to do is actually have a system of making sure that people who had potentially been kind of long-term inpatients or users of the hospital start to engage with the community and come out. So that's been a positive kind of practical thing that's come out of it. Now, interestingly, prior to doing the volunteer strategy, 2 years ago we did a survey in Edinburgh and of the 800 organisations that we work with, and said how many of you have a role within your organisation that is dedicated to volunteers management. And at that point it was about half of them. So 2 years later there are more people who have a dedicated role that is about volunteers management. I have to say, in the last 6 months there's been a real threat and a crisis to that, with the recession and the funding crisis and things kind of falling off the edge there, but it's has been better. And there's been much more recognition and a much higher referral rate of public partners, of people saying volunteering would help you engage, it would help your health, it would help your employability, and partners are pushing much harder on